So I'm going to go ahead and talk. I know we are starting at 11:30. We went ahead and opened the webinar so that everybody can start entering in, but we will get started at 11:30. So I know people are like, oh no, is the sound working? And it is, we're just not talking yet. So bear with us. We'll start in just a little while. Right, well, it is 11:30, so we'll go ahead and kind of get some of the logistics out of the way. My name is Kathy Frakes, and I am the Director of Financial Planning for Omega Wealth Management, and we are delighted to have you all join us today for a webinar on long life planning. You don't have to do it alone. And it's our privilege to welcome Jennifer Ward from Fairfax County. She is a highly skilled licensed social worker with over 10 years of clinical practice and community level experiences in all areas of case management, community outreach, program administration, and self-sufficiency. She has her Master of Social Work degree from Boston College in Chestnut Hill, Massachusetts. She also is a certified community resource specialist, and she has a strong passion for financial coaching, financial counseling, and helping clients in achieving financial well-being. So we are thrilled to have her with us today as our guest speaker. During the presentation, she's graciously offered to answer questions as they arise. I'll be monitoring the Q&A box at the bottom of your Zoom screen. So if you have any questions, feel free to type them in and we'll answer them as they come. And if we don't have the answers, then we'll research them and get back to you. But Jennifer, with that, I'd like to welcome you and let you have the floor.
Good morning, everyone. As Kathy has said, my name is Jennifer, and I work with Fairfax County Area Agency on Aging. The division I work for is Aging, Disability, and Caregiver Resources. We are the intake line for families, clients, individuals looking for resources in the community. So I tend to know a lot of the resources that are available to Fairfax County residents or people or family members or caregiving programs. So I'm just start with the PowerPoint. Let's start here. So first, I want to just Fairfax, the mission of Adult and Aging. We want to promote and sustain high quality of life for older adults, adults with disabilities, and caregivers by offering a mixture of services and resources provided through private and public sectors, which maximize personal choice, dignity, and independence. And when we think about personal choice and dignity and independence, we think of the word aging in place. We do like the model of seniors, older adults, living at home in their homes or in their families so that they can age in place and they have the self-determination to be independent. So that's what we prefer. Some of the business units of AAA, the Area Agency on Aging, first is, my unit, which is the intake unit. The second area is disability rights and resources, which is for those who are, disabled. Now, this doesn't necessarily pertain to just seniors. This is anyone over 18 who needs help with reasonable accommodations, things in their home, like grab bars and things of that nature. ElderLink is similar to like case management for older adults, but this is more for those with higher level of income. So individuals who make $4,800 a month for an individual. So that they're going to get case management, respite services, things of that nature, things that are a little over the Fairfax County's income guideline. Now, the long-term care ombudsman's office. That's more for those who are staying in facilities, for nursing home, assisted living, who have complaints. So this office is charged with investigating issues or complaints or care related things for seniors who are in institutions or in housing and they're not necessarily happy. Nutrition, Meals on Wheels. This is what most people are familiar with, is Meals on Wheels. So this is for anyone who's a senior, who's over 60. So this is more universal. It doesn't have an income guideline. So if someone needs food, they're not able to prepare meals on their own, they live alone, that would be more suited for a senior in that area. VICAP, now this is for those who have questions about, so it's called the Virginia Insurance Counseling and Assistance Program. So this is going to be more about if you have questions about when to enroll for Medicare, what drug plans would work for you, for your prescriptions, that's the line, insurance line you would call for counseling and assistance. Volunteer Solutions is for those who are interested in volunteering with seniors and the community centers and things like that. But right now they're actually on hold right now because of COVID. The senior centers have not completely opened up, but these are for people who, Volunteer Solutions is more for that. And the Golden Gazette is more of a publication that goes out quarterly, and people are publicizing, like they want to promote, they have a business, if they do wills, if they do financial planning, if they do, tree cutting services, or things that would really cater to seniors or older adults.
Jennifer?
Yes.
The Volunteer Solutions.
Yes.
Is that for seniors who would like to volunteer, or are these volunteers that will help seniors?
So this is more for, so it's kind of both. So this is people who are interested in being a volunteer. There's no, you can be a senior and want to help other seniors, or you can be over 18, background check. So it's a little bit of both. So these are people who are interested in helping a senior, or a senior helping other seniors.
Wonderful. Yeah, thank you very much.
So the ADCR, as I was saying earlier, we're open Monday through Friday, 8 a.m. to 4:30 p.m. And I just want to say, I know I'm speaking a lot about Fairfax County programs, but most counties, they do have a social service unit, and an arm of the unit is Area Agency on Aging. And they're armed with providing services for seniors, disabled, things of that nature. So again, while I might be just focusing on Fairfax County resources, because that's the area that I feel like I have the most knowledge in, most counties, Montgomery, Fairfax, Prince William, and any other county outside of Virginia, DC, Maryland, they do have a similar program, but I can't speak to the exact income guidelines or things like that. But what we do is we provide information on county and private pay in-home care. We provide free consultation, respite services, and education to a senior or their family members. So for instance, if they don't qualify for county programs, and we'll talk to them about other programs that they might be able to self-pay for, or more affordable, things of that nature. We also screen for reports. We're also charged with making sure seniors are safe and not in a position of being abused, neglected, and things of that nature. So we do take reports of abuse, neglect, and exploitation. We're not the workers or the investigators, but we do get those calls and assign those to workers. So adults 65 and older, and young vulnerable adults. So anyone with an intellectual disability, 18 and over, anyone with a developmental disability, 18 and over, we're charged with making sure that they're protected and safe. So this is where we get a lot of our calls for services or people want additional information. So the first one is home-based care. So this is for a senior, and this is more universal. So your income doesn't have to be like really, if your income is a little high, the county will work with you, and it's not Medicaid paying for it. It's more services. You have a disability, you might live alone, and you need help with a couple things, like you're not able to bathe yourself, or you have issues with light housekeeping or laundry, or you might need Meals on Wheels, like home delivered services. So that's more the lower end of help that someone might need. And, some people who have like, they might have like a physical mobility issue. They're not able to get out. So more for them, but they can still do all other things. So they're semi-independent. The next one is more for those CCC plus. So that's the Commonwealth Coordinated Screening. And this is usually something that gets paid for by Medicaid, the state program. And what that is someone is saying that if they don't get a caregiver in the home, they would be at risk of going in an institution, nursing home, or things like that. So people are usually calling us because they need help with a lot more activities of daily living. Some of those things are, they're not able to bathe themselves. They have continence issues. They have, they may need a life alert system, or they may need help with medication management or money management. So usually with this one, you have to meet a higher level of functional ability, and or not being able to do it. Many people with dementia may need that. They might be forgetful. They might forget. They might not be able to prepare meals because if they forget to turn the stove on, that might be something that might qualify them for that. And then we also get a lot of calls for the home care registry. So Fairfax County has a program where they've vetted CNAs, in-home providers to do bathing, chores, things like that. But this is self-pay. So usually people who have higher level of incomes would self-pay, someone, and usually they speak different languages. They offer different services. They've done a background check on them, fingerprints, and they serve different areas of Fairfax County. Someone a family member might be calling, I want to self-pay for a person. Can you give me the updated list for that?
So these are vetted people.
Yes. So that they have to do a background check every 2 years. And that includes fingerprints, they review their certifications. They review, so the home development program of the office, the area agency, that's what they do. They're responsible for vetting people, checking their credentials and things of that nature. And I think when family members hear that, they are very excited because they know these aren't just regular people. They know that they've been referred and things of that nature.
Absolutely. I think that's one of the biggest fears, is inviting a stranger into your home. Excuse me.
Yeah.
So yeah, that's a wonderful resource.
So good, move on. So I want to talk to you about, I'm just going to speak to this a little bit, which is called spousal impoverishment. And this is going to be more for people who are looking to apply for the CC plus waiver. So this is for Medicaid to pay for a caregiver in the home. So under this, the Medicaid, basically under this program, if a couple, what happens is in the past, a couple was together and someone got sick, and that would wipe out all of their resources. That would wipe out all their income. So the well person, had to drain everything to make sure that we call it the sick person, or who was in a nursing home, or they wouldn't have anything. So with this spousal impoverishment, if couples created wealth together up to $260,000, only $130,000 is protected. So for instance, if they have assets like a car, the family car does not count, the family home does not count, things of that nature. But if a couple has more than $260,000, they do have to spend that money. They can buy like a roof, they can make changes in their home. They cannot give it away, but I just want to make sure people with higher incomes know that, because that could, they make sure they protect the well person, but they also, Medicaid has a rule about how much money you can earn. And Medicaid is Virginia's state insurance program that pays for caregiver long-term care services in the home. Is there any questions about that? I know that's complicated, but I just want to make sure I put that out there. Okay.
I don't see any coming in.
So I want to start with going to Senior Navigator. And this is for, it's a nonprofit guide for those living, just give me 1 second here.
And this is available online?
It is available online.
Okay.
I'm just waiting for it to pull up. It's really slow.
You may have to share a different screen. Yeah, there you go.
Let's see, here we go. All right. So this is very useful if you're just starting out and you need information on anything in Virginia related to seniors, how to navigate the systems. So let's start, for instance, aging well. Someone might need health, a place where someone can go for, free clinics or low-cost clinics. So you click here. And what I like about this is that you can put in your zip code. I think there are other states who have a similar website, but it might be called something different. So for instance, say I was looking for a place in Fairfax for a free healthcare center. It would point me in the direction. Say, for instance, someone was waiting for their Medicaid, Medicaid lapsed or Medicare lapse or something happened and they needed a low-cost clinic, in the meantime.
Mm-hmm.
This is a place, so for instance, the community clinic has their number, things of that nature. And then it has the free clinics that provides free clinics to those. So it may be more for people who don't, who might have lower income or don't underemployed or family members that don't necessarily have resources. So that's for that. And
Under
then,
the aging well, I think I saw something about healthy living and prevention.
yeah. So for instance, let's do. So this is going to, again, so this is going to be all resources, not just with Fairfax County. These are going to be resources throughout Virginia. So let's see, general wellness screenings. The computer just being really slow. Okay. So I'm going to put in Fairfax. That's where, where I work. Okay. So for instance, so this is general screenings for any particular disease or condition. So for it's a cancer health screening, breast diagnostic center, and they're actually really good. I've used them before. Health screening, if kidney. So it's a good starting point for that. I'm going to go back to this and see if there's anything else. Let's see, medication management. That's a one that comes up a lot. So for instance, prescription, when people have to buy prescriptions every month and fit that into their budget, sometimes it's overwhelming. Sometimes it's a new prescription, sometimes it's not a generic prescription. So these are programs one might reach out to for help with, maybe, not necessarily monthly, but maybe to help offset the cost of a, chronic illness or things of that nature. Let's see here. Here we go. So for instance, medication assistance, Northern Virginia Family Services, and they're a great organization. So what may happen here is that someone might need help with a prescription, they contact this organization, and then they either have a sliding scale fee or it might be free. But this is a great resources for those who are taking medicine every month and it's, affecting their budget. So I've actually worked with Northern Virginia Family Services, and they do a lot of amazing things with, families in this area and clients. Some of these places. So some of them might just be making a call. Some of them might only serve, like Woodbridge may only serve Prince William County. So it's really just just taking a stab and calling. So I see some are in New Jersey. So this might be Illinois patients. So just to help people who are on fixed income. Some seniors are on fixed incomes and they need help with stretching their budget, as you may know. So that's that.
Yeah, we have clients who have aging parents up in New England and limited income and that sort of thing. So this might be a good resource for them, it looks like.
Yeah. And then let's see here. So we get a lot of questions about financial assistance. So, there might be seniors or family members of who, paying for care is one thing, right? But then having the basic needs expenses like food and utilities. So there are programs that may help with, so for instance, for seniors, there's a lot of programs out there that help seniors with home repairs in the home. So say for instance, they need a grab bar in their bathroom. Fairfax County has it's called Home Repair for the Elderly. The only thing is the income, you can't, for a family of two, for a couple, you can't make more than $50,000. So that might push some people out of that program because it is income based. But if not, then they'll give you resources of places where you can go. So there's also energy assistance. So people who have to pay utility bills, in Fairfax County, there's Washington Gas, there's Dominion, Virginia Energy, and those expenses, in the wintertime and in the summertime, they can go up. And then, some, people are caring for family members and those expenses can really be taxing. So I'm going to go to this for a second. Let's see, energy assistance. Being a little slow today. Here we go. So I'm going to put Fairfax. All right, so here, the county has, so it'll pull up, populate programs in Fairfax County that will, first they use the Department of Family Services. Unfortunately, with a lot of the county programs, there are income guidelines because these are state programs, but some people who are on a fixed income might qualify for energy assistance every month. So they might be able to get assistance with their utility bills every month, particularly Washington Gas and Dominion. If they have a monthly bill, so some of the places, so they would make an application with the Department of Family Services for that. And then there's also nonprofits in Fairfax County. Salvation Army is a big one, and Salvation Army serves is in most counties, in most states, and Salvation Army, they do a lot of help with fuel assistance, someone's getting disconnected, and things of that nature. And I'm not sure if you have seen that, but that does happen a lot. There might be seniors who have other obligations, or the caregivers might have other obligations, and maybe at risk of getting disconnected. So that's definitely a resource. I do want to talk about some of the health programs that are available to seniors. The only thing is, because of COVID, a lot of the centers to go inside are closed, but they are doing a lot of virtual programs. So I'm gonna pull up, give me 1 second here. I'm gonna pull up the Fairfax County Neighborhood and Community Services.
Yeah, because we know that being in community is a very important part of aging well.
Definitely. And people, seniors need to be able to socialize, need to be able to work out, need to have, mental stimulation.
Right.
Of that nature. So, but because my calls that I get, or people I talk to, what I've seen is people have declined because of COVID. They're not, their health may decline because they're not able to be as active, or they're not socializing, or they live alone.
Right.
It's important that that older adults still stay connected, and we want them to still get services in the home. So I'm going to stop the screen and I'm going to share another screen here. Let's see here. Okay, give me 1 second. That's not the screen. I'm just trying to pull up the right screen so that we're on the same page. Okay, there we go.
I know you said the senior centers are closed at present. Do we have any concept of when they may be opening now that vaccination rollout has started?
Well, the vaccinations have started through the health department, but there's no, right now, most things are just virtual. And they haven't, you know, there was some talks of them opening up this summer or earlier, but that because of, you know, the surge in COVID, those talks keep changing. So I think
very fluid. But if they check on this website, it'll tell them when
Yeah.
they're opening again. Okay.
Let's see here. But I want to make sure we get to, you know, I want to talk about, let's give me 1 second. It's so much here, so many resources that are amazing for older adults.
Mhm.
Stop this for a second and share the screen. Here we go. So senior centers, can you see this here, the senior centers?
Okay.
Okay, so in Fairfax County, there are several senior centers, and in Fairfax County, things are broken down by where you live. So there's different regions. So if you live in Reston, Herndon, Great Falls, McLean, there's a senior center for your area. In some cases, there might be 2 or 3 senior centers in that area, depending on the population. In things like Fairfax, Oakton, Dunloring, Merrifield, there's a senior center that covers that area. In Annandale Falls Church, some parts of Alexandria, there's a senior center. And then we call the last part of Fairfax County, Route 1, and that's going to be more Fort Belvoir, Alexandria. So here are senior center locations. So these are typically where seniors would be going, and they have a whole schedule of events, typically where they can do exercise, they can do games, they can work out. You know, they can be a part of the senior council to make decisions.
And is this free, or do you, it sounds almost like a country club? You know,
Yeah,
lots of activities for the seniors.
It depends. So what I would tell people to do, the last time I checked, it was maybe $55 a year. It wasn't too expensive, but you know, many of them have scholarships, or someone's very active or really needs this program. Neighborhood and Community Services, which is under Fairfax County, it's not under the Department of Family Services. They're very welcoming to those who can't afford it. But the last time I checked, this was maybe a year ago, it was like $55 a year, which is a bargain, because most gym memberships or silver sneakers is a lot more higher at some of the gyms. So some of the facilities, so here, you know, let's say someone lived in Alexandria and they wanted to join the senior center there. And what I like about some of the senior centers, they're also attached to senior housing. So through Fairfax County, some of them have, the people live next door and they're able to go to their senior center to meet other people, and then to also do congregate meals. And congregate meals is more so the Meals on Wheels, where they eat together, they pay a small fee, you know, and they talk, eat. It's in a cafeteria style setting. And, you know, the senior centers do awesome programming. I want to just go and see what look at a calendar so that we could see what they have going on right now, because everything is virtual. And I know that these things are so fluid, so they may change day by day or week by week. Let's see here. And I apologize, my computer is really slow today. Normally it's really fast, so let's see. That's not. So like if for instance, someone was online and they wanted to find a senior center, a caregiver was, they had the family member in the home or wanted to help, they could pull up this website here and just find the local, senior center, click off, just trying to see what would make it easier.
But you've kind of given us an idea. There are meals, there are activities, there's exercise classes, that sort of thing is what we would find, possibly even music or dancing.
Absolutely, yeah. And I've been to a few of the facilities, and on Saturdays they do like a family day. They do a lot of service days. They're really, really, really active, and that's why I think if someone was aging well at home, and then also using these programs, the senior centers, that really enhances their quality of life to really be independent, but also to socialize and get their their emotional, physical, mental health needs met.
And is this different than perhaps senior daycare that we hear about?
Yeah, so senior daycare, usually you're screened for that through, you have a nursing need. So for instance, a lot of people who go to senior daycares have dementia, Alzheimer's. So they may need a little more help with in terms of like sitting or eating. So the daycare is going to be more, you're going to be screened for that service, and that's going to be, more guided, more assistance with your ADLs just during the day. And it's also kind of like respite for the caregiver, for a family member who may live in the home, and then the family member knows that, or the caregiver knows that they're safe at a place during the day. And often they get transportation through a program called Fast Tran to take them there. So they're there for a couple hours, they come home, and that kind of like helps them so they're not necessarily in the house. But yeah, so the adult day centers, usually you have to be screened for that program. The senior centers open to all. And now from what it used to be, you had to be 60 for that program, but now I think it's they go back and forth, but the last time it was 55, and the last time I checked it was 50. So I think they go back between 50 and 60, but 55 is typically when you can enroll in the senior center.
Okay, there are a lot of us on this call that can participate.
So then I want to talk about some other things that might be helpful for seniors. And some of them are going to be private programs, and some of them are going to be Fairfax County programs. Let's see here. So I want to get to here. All right. So for instance, there's so many resources. So there might be some seniors who want to go back to school or might want to learn how to drive or things like that. So I'm just going to scroll through this a little bit. Unfortunately, the libraries, the libraries aren't necessarily available for people to go in and get trainings or things like that. But the self-talking, getting the help with books and getting those online. I talked earlier about Fairfax County Adult Protective Services. I'm not sure. Many financial planners and wealth management, they may be mandatory reporters. Mm-hmm. We may work with the mandatory reporters if they're concerned about someone or one of their clients, or might be a caregiver who might be exploiting a family member. So that's something that we also want to make sure we're charged as AAA to make sure that the safety of seniors, basically they're being protected. We talked about some of the adult day health centers. So there's a few here. Usually they have a cognitive disability, the mental health, it might be Alzheimer's, dementia.
Jennifer, can we get a copy of this to make available?
Absolutely, I can email that to you, yeah, definitely.
Thank you very much.
There might be a business that is working with a senior who may have taken advantage of them, overcharged them. So caregiver might be concerned about that. So Fairfax County has a division called Cable and Consumer Services. So if someone wants to file a complaint, they have consumer specialists that investigate. They're not attorneys, but they will help investigate, mediate issues related to, senior abuse or exploitation or taken advantage of. So for instance, someone might need senior might need a tree cutting service, but you hear that the tree cutting service charged them 3 times the amount they would charge someone else. So that's when somebody might get involved, or family member might be concerned once they learn that. So it's for, just to invest, basically to complain and then get mediation and resources. VICAP, so this is for those, I think this is a really good program for those who are disabled, who are getting Social Security disability, and at the point where they can get Medicare. And if, there are a lot of questions about what plan to get, what's the best thing for the family, the charges, the Medigap insurance. So Fairfax County, Virginia Insurance and Counseling Assistance Program, my colleagues in this area do a great job at helping people figure out, based on your prescriptions, or based on someone's prescriptions, or based on their needs, what plan to get to help them stretch your budget. So they do a lot of community outreach, conversations about Medicare, especially in Virginia. I'm going to scroll down. The Northern Virginia Long-Term Care Ombudsman's Office. This is what I spoke to earlier. So this is for those who are, we hate, not that we hate, we prefer people to stay at home, but in the event that they're not able to stay at home and they're in an institution, they're in a facility, nursing home, and they're in a caregiver or family member is concerned about them, this office is charged with investigating the assisted living, nursing home, and complaints, or if they feel like their family member isn't getting enough care, or the plan isn't being abided by, or they're not getting their prescriptions or medication at a certain time. The Fairfax County office, Ombudsman's office, they're charged with that. I'm just going to scroll down a little bit. That would really, some of these don't pertain to just more general information. Now, there might be seniors or people who want to get back to work, or may want to get a part-time job. And the Fairfax County Skill Source Center, they work with older adults, and they do resume help, they do job interviewing, preparation, they do job fairs, and I've seen them do some really amazing things. They have funding, especially for seniors, so they may have jobs that cater to seniors. So these are good places to know. Right now, because of COVID, it's assistance from a distance. So, you're not able to go in to the office, but they do a lot of things on the phone or virtual, and in some cases through email. So similar, webinars on training, on jobs, for career changers. I just want to scroll
It's
down.
a great opportunity for expanding one's mind, as well as community, and
Right.
feeling that sense of purpose that
Absolutely.
a lot of people need. Yeah.
Absolutely. Yeah. And, there's some people that might have worked, 30, 40 years or 50 years, and they want something different. They want a career change. So this office is very helpful in terms of training, or just helping people learn a new skill. So that's a good resource to have. I'm just going to piggyback on that. There's an organization called seniorjobs.org. Now, that's not a Fairfax County program, and that may come with a fee. So we try to get people to use Fairfax County programs first. And, they want additional resources. Senior employment resources is really good. And they usually work with people 55 and older. So Fairfax County, when we say the Department of Family Services, so the social services, they're going to be more like public benefits. So there might be people who get food stamps or Medicaid or fuel assistance. So they have to apply for these programs, and it's through the state, and it's many of them are income based. So the Office of Department of Family Services provides those entitlement programs. They have to apply, they have to, have verifications. So this could be helpful for those who might need help with their utilities, who might need help with additional food resources through the SNAP, the Supplemental Nutrition and Assistance Program, also known as food stamps. So there might be fixed incomes, and they need to be able to use all the resources that are available to them. There might be seniors who have Social Security as a part of their income, whether that's retirement, Social Security, disability. That's just a good contact to have for questions. Social Security isn't administered by Fairfax County. That's through the federal government. Let's see here. I don't think, so Fairfax County has a division where seniors may be taking care of minor children, and that it's a kinship program, and that might be something useful for seniors. And it helps them if they are, still aging in place and they're taking care, intergenerational, they might be taking care of their children's kids. This is a good socialization, like getting people together, talk, eat, talk about the challenges of that and things of that nature. Here, the home repair for the elderly. So like I was saying, this is really good for seniors who need a little bit of help in the home. They may need they might need the help with the labor for their roof being repaired, or I'm trying to think of, they've helped with some install grab bars. They've helped install like lights and stuff. But the only thing about this program is it's for an individual. You can't make more than $40,000 a year. And for a couple, it's $50,000 a year. So that may exclude some of the higher earning incomes.
But you mentioned they might be able to offer resources for people who have income
Absolutely.
higher than that.
Absolutely, right. So I'm going to scroll down a little bit. And so one of the ones that we often refer people to is Rebuilding Together. And they might be able to help those who need help, but they have higher incomes, and they can contact them directly for an application. It may come with a wait list, because a lot of these programs are in high demand, and because of COVID, it has put a damper in the efficiency of being able to do it quickly. But this is a great program for seniors to be able to be at home and get services in the house so that they're safe and
right. I have a friend who actually volunteers with Rebuilding Together, and he has done all kinds of things, including he's a licensed electrician, so he's been very helpful to a lot of seniors.
Awesome, that's great. And then it might be seniors who need help with wills, who might need help with legal guardianship. So that's going to be more for, let's say, a family member or a caregiver. The senior may be at risk of losing capacity. They have dementia, Alzheimer's. They're not able to make decisions on their own. So at some point, somebody might need to consider the power of attorney. That doesn't require necessarily going to court to petition the court, but legal services in Northern Virginia, it's not through Fairfax County, but it's very helpful in terms of getting people, the resources for wills, trust, helping the caregiver or the family member work through things like, what happens if my mother loses capacity or my father loses capacity, and I need to make those decisions on their behalf, what things I need to do to be able to prepare for that. And then, there's some things like there might be people who need a wheelchair, seniors might need a wheelchair, that there are programs for that. And that, it's not in Fairfax County, but they do serve Northern Virginia. Again, that's for those who might have limited mobility. They might need to stay in place. And wheelchairs are, if they don't have, if Medicare doesn't pay for it, it can get really expensive to pay out of pocket for durable medical equipment. I'm trying to think, is there anything else?
So the recreation, real quick, go back just a little bit.
Yeah.
That's one of the things we really encourage. It's especially, I'm looking out the window at the beautiful spring air, and even with COVID, we can get outside. Some of the parks and recreation, that's one of the things I would encourage folks to look into.
Definitely. And like I said earlier, a lot of these programs, before COVID, they were doing some really active, robust programs. But now a lot of the programs are, now they're basically, virtual, but, they have a schedule of events. And what I would encourage people to do, if there's a community center or senior center in the area that is of interest to someone, to take a look at their website and to call them directly, because they may have some really interesting webinars. What I want to do, so I'm just gonna, sorry, here. Okay, so what I want to do is go to the caregiver resources that might fit well here. Give me 1 second here. Stop this screen.
Because as we were talking about earlier, Jennifer, sometimes this doesn't apply directly to us yet, but yes, it may be that somebody's helping care for aging parents.
Yes.
Or eventually, Lord willing, we'll all get older too. And may need these.
It's just good to know that there are resources
right
that are out there. Let's see here. Can you see this family caregiver support group? Can you see that? Yeah, so that's not my area of specialty, but this is an area for those, who are caregivers. You're basically providing care or support. And sometimes it might not be necessarily, you are the person who's getting paid to provide caregiving service. You might just be a daughter or a son who needs help. You're overwhelmed. You're kind of taking on the role of a provider. So they have a they have support groups, where they tell you, like, every month they have different topics on how, caregiving, stress, and healthy living, and what that means. I'm going to just click on this.
Mm-hmm.
Most of these are webinars, so I'm not sure.
That's so important, though, because caregiving can be exhausting.
Yeah.
You need to take care of yourself. As we like to say, you put on your own oxygen mask first, right?
Yes. So
This social side verbal is about to become the backdrop for an unforgettable vacation memory.
I'm not sure it's okay.
I'm sorry, let's see here, new share. Okay, we're back here. Okay, can you see this page here again?
Yes.
Okay, so sometimes people just want to know, like, the family member may have been diagnosed with dementia, so they want to know what that looks like and what that means. So sometimes some of these webinars will fit exactly what someone might be going through. Because again, being a caregiver is a lot of work, or being a family member of an aging parent, or, I would say what I see a lot of children taking care of, mother-in-law or dad-in-law or things like that. So these are really great webinars to help people kind of sort out what it means to be a caregiver, some of the family dynamics that come into place. And then I know when COVID hit, people were really scared, and their parent was in a nursing facility or was home. They didn't want people in the home. So, things about COVID, like, what does that mean to still be safe and practice social distancing?
Mm-hmm.
And then how to hire someone, like, say it comes that time you have to hire someone in the home for a loved one. You may not be the actual paid provider, but you have to think of some of the things you have to think about. So they have really good webinars on that. And then some of the like just the basic, like taking care of yourself, inviting joy into your life, conversations about, learning about Medicare. What does it mean? Self-care, which is, I'm big on self-care, and that's really important. You can't pour from an empty cup.
Right.
So some of those things, so taking care of yourself, making sure you get rest, delegating, seeking help, and things like that. Just want to make sure Now, was there any before because I know I'm talking a lot. Is there any other questions before I?
None that I haven't raised. Yep.
Okay. Now, I know also, this is very new. Virginia has a program, well, it's kind of an incentive. So the state of Virginia has a voucher program. So it's like a one-time payment. So if you are caring for someone and you're able to demonstrate that, you get a one-time payment from the state. It's not a lot of money. I think it's a couple $100s. So it's not through Fairfax County, it's through the Virginia Department of Adult and Aging. So that's just good to know. Sometimes people, might need some extra money to get their car, do something with their car, or like they're driving around a lot, or taking mom to medical appointments, or mom or dad to medical appointments, or, this might be something that you might need information on in the future. So that's a good program to have. I'm trying to think before I move on, let's see here. Oh, okay. So earlier we talked about the home care registry, and I want to let's just stop share, and I want to take you to that page where you see someone's qualifications. So let's see, share. So here, this is when someone's saying, I want to self-pay for a provider. This is a link I normally send out to families or someone who wants to pay out of pocket. I apologize, my computer is really slow today. Let's see here. No, so here. So this is from Fairfax County, our home development program, and it talks about the screening process, the references, what they do for a background check, stuff like that. All the criminal history checks, 2 years or sooner.
Jennifer, we're not seeing that screen if it can.
Oh, you're not, okay, let's see here. You're not seeing that? Let's try this again. Here we go. Can you see the screen?
There we go. Thank
Okay.
you. Yep.
So how to choose a provider, the program. And I'm going to send this to you in email as well.
Thank you. I'm sure that.
For instance, this is a person who's registered. They're a CNA. The languages what areas they serve, they speak English. What population. So the next person, the populations they serve, what areas of Fairfax County they provide services to, what their background is. And then some of them get a little more detail. Some of them just do friendly visiting. Some just do companionship or respite, like or some could do light housekeeping. But this is going to be
helpful to have somebody who's already vetted and had a background check. Absolutely. That's a tremendous help for people.
Absolutely. And so this is going to be more for people who are paying out of pocket. Now, typically, this is paid for by the CCC Plus waiver. So there's one person who may work for an agency, so they're not necessarily private providers. They might work for an agency, and they're the caregiver, and they're charged with doing all of this. Like they're charged with providing meals, and that's why people want to be screened for the CCC Plus Medicaid waiver, because in essence, they wouldn't have to pay out of pocket for services. The Medicaid waiver would pay for that. But again, there might be folks who don't qualify for that because of income or immigration status or what have you. So they might not be able to do that. So that's that.
Great.
So this is just helpful, and this is updated all the time. If someone was looking for information on a provider out of home. And I think what I want to do is end it with Fairfax County has a basic need resource guide. And this is really helpful for, let's see here, I'm going to share screen. Let's see here. really helpful for those who, in most counties have this program where they have, let me share. Can you see the screen, the Fairfax County Human Resource Guide?
No, we're still in the PowerPoint. I think you have to
Okay.
stop and start again. Yeah.
Screen. All right, let's see here. Can you see that there?
Still in the PowerPoint.
Huh. Let me share. Why is it not? Oh, here we go.
There it is.
Okay. So for instance, let's say I'm going to put here. So this is good. If you can do this in the middle of the night, you can do it anytime you want. So say I'm looking for senior, let's see, taxes. Right now, taxes, people need help with their taxes, or if they don't have a private person, they may want, let's see here. So I'm going to put, oops. Dun, dun, dun. Nothing found here. Let's see here. Transportation is always a question that comes up for seniors. How if they can't get around, or a family member isn't able to take them somewhere. Let's see here. Let's just start here. So all the records, different places that help with transportation. And it says, for instance, if somebody needs, the Jewish Council for the Aging for Greater Washington, they provide information for transportation for older adults. So what I like to do is just scroll down individual disabilities, because sometimes someone might be a senior, but they might also have a disability, so they need specialized paratransit. So it's a wonderful website to kind of you can use it at any time. It's updated often. Let me see if I can type in older adults and see all the things that come, because you can put in keywords. So that's that one came up, Mount Vernon Home, individual disabilities. So usually people live in a certain area. I know Fairfax County, they have a transportation program. So seniors who can still access cab services and things like that nature, they pay us an amount for subsidized taxi service. And you can use it for a couple of taxi services in the area. They have to apply for that program. It's called Seniors on the Go. There are also programs for those who have dialysis, who are on dialysis. They might be getting chemotherapy, the seniors. So there's a program called Fast Tran, where they help people get to their appointments, their medical appointments. And there's also a program through I'm blanking on the name, but there's a program where if you needed a ride to, you're a senior, you needed a ride by another senior to a medical appointment or go shopping, it's called the Shepherd Center. So they serve certain parts of Fairfax County. So they serve McLean, Herndon, Reston, Falls Church, Arlington, Fairfax. So there's certain areas where these nonprofit groups have gotten together to serve people. They go back and forth. Some days they're serving people to take them to medical appointments. But because of COVID and because the volunteers are also seniors, I know they are restructuring or have changed some things, but that's a good resource. And it's also good to connect with other seniors, because the seniors are the ones driving their vehicles to taking other older adults to medical appointments, shopping. One time Fairfax County had a neighbor to neighbor program where volunteers would right during COVID hit, they would take them to medical appointments and get their prescriptions. But right now that program has been suspended. So that's not something that we could refer people to. I think that's pretty much it.
Well, Jennifer, thank you so much. I hope people come away knowing that there are a tremendous number of resources. I mean, we covered a lot. Some are, of course, income-based, but not all. Right. And I think that's important to remember too. And that's part of the financial planning that we can help you with is, are we going to have enough resources for that long, healthy lifestyle that you want, and what kind of opportunities are there for you to continue to invite joy into your life. I loved that title.
Yeah.
And participate with others and be in community. So we thank Jennifer very much for your time and expertise. And thank you all for joining us. We'll be recording this and sending it out. In the next couple of weeks, we'll also have some long life planning articles coming out about well-being and health and gardening. We'll also have a webinar on June 15th, 2021 at 5:30 with regard to Social Security. So hopefully you can join us then too. Thanks.
Great.